Hello, welcome to the presentation on health protection and health promotion model. My name is Maren Easty and I will be going through this PowerPoint today and explaining more about this model. So first off, who created this model? His name was David R. Austin. He was a professor of recreation from Indiana University of Bloomington. And he came up with this model and really wanted it to expand and help those that need better wellness and want to have more fulfilling lives. So to begin, the underlying concepts within this model, the first one is humanistic perspective. So within the health protection and health promotion model, it rests on this humanistic perspective. And individuals are responsible for their own health, and it's critical that they become involved in this decision-making field and they fulfill it to their best ability. Along with that, under the humanistic approach, people are seen as being in a dynamic interaction with their environment, in which both their environment and then interacting within it are affected. And just as the quote that says on the PowerPoint, those who embrace a humanistic perspective believe that each of us has the responsibility for his or her own health and the capacity for making self-directed and wise choices regarding our health. And one last thing on humanistic perspective, it is that it recognizes that people have the capacity for self-development throughout their life. The second concept is high-level wellness. So high-level wellness is gained when we exist in a very favorable environment or something that we enjoy and that we love doing. And just as it says on here, that high-level wellness is defined as an integrated method of functioning which is oriented toward maximizing the potential of which the individual is capable. All right, another underlying concept is stabilization and actualization tendencies. And both of these are really important, and on the next slide we'll go in a little bit more about what these two are. But the stabilizing tendency is concerned more with maintaining the steady state of the individual. And with this tendency, it motivates the client to move away from negativity and the things that cause the illness and the injury and kind of the setback. And so it's more making them steady on what's good. And then the actualization tendency part of it is it drives this client toward health, and they focus on reaching that high level wellness like we talked about before, and having that joy throughout their life. And then the fourth underlying concept is health. And kind of the definition of health is it is a state in the life cycle which implies continuous adaptation to stress in the internal and external environment through optimum use of one's resources to achieve that potential daily living and having that optimal wellness. And one thing about health is it encompasses both adapting to your life and growing and becoming better. And it really, healthy people are able to cope with life stressors a lot easier. So kind of in summary with all of these, it's based on a humanistic perspective from which flows the assumption that all human beings have an inherent drive for health and wellness that can be nurtured by professionals like us as therapeutic recreation specialists. All right, so going into a little bit more about the stabilization and the actualization tendencies. The stabilization part is more the part that pushes us toward that steady state, which protects us. And the actualization tendency is more, it's fulfilling our potential and feeling satisfied with obtaining that wellness. And then kind of defining the health protection, health promotion model. Health protection is restoring that part that's limiting us, that barrier that is there. And then the health promotion obviously is just trying to enjoy the life that we have and to gain that optimal experience. All right, so this is the model, and it's kind of blurry, so it's hard to tell what it looks like. But we can see that we have 3 different sections. So the prescriptive activities, recreation, and leisure. And as we can see that with the prescriptive activities, it's more of the therapeutic art specialist is directing it. And then as they get closer to the leisure side, it's more the client is directing it. And that's what we want. That's the goal of these models, is we want the client to become more independent with, I guess, understanding their health. All right, so describing those parts in the model. So the prescriptive activities are those that include ways that we can overcome the barriers. So when people are ill, sometimes we can get self-absorbed and kind of withdraw from society and everyday activities. And some of the time they aren't ready to participate in recreational activities because of this barrier. And so that's when we come in we come into the picture and we're more directing what the client should be doing. And this is something that starts a little bit slower, but it can energize the client and get them back into life, and they're starting to regain those skills and overcoming those feelings of hopelessness. And as long with that one, the clients start to become, I guess, feel more confident, and they need the therapist less. And so if we go back to this, we can see they're moving upwards. So they're becoming more confident and understanding a little bit more about health. The second part is recreation. And recreation is used to restore the person or recreate the person, help them kind of get back to normal life. And we know through all the other models that we learn about that recreation is something that really helps us. It really kind of defines who we are, even with the barriers and limitations that we have. And in this position, the client and the therapist work together to decide on activities that they want to do, to see what part of their health they need to continue to grow, and things like that. And along with that, the client still begins to gain confidence and have self-efficacy. And then the third part is leisure, which is something similar to recreation, but it provides that feeling of excitement and growth and self-determination and satisfaction in being able to overcome those barriers and still participate in the things that the client wants to. So the mission of mission of this model, and in the words of David Austin, he says, the mission of the model is to use prescriptive activity, recreation, and leisure in order to help people meet problems that create barriers to health, and then to allow them to enjoy the highest levels of health and wellness possible for them. And that's a pretty bold mission, but it is something that can be done. All right, so some of the strengths of this model, the health promotion, health protection model, is one, it sets boundaries for the therapeutic restoration profession by conceptualizing the tiaras involving purposeful intervention to improve health and well-being by both protecting and promoting health, hence the name of the model. Second thing is it has a sound theoretical foundation, and this model is based off the theory of the humanistic perspective. And then the third strength is it has well-constructed conceptual models that both describe therapeutic recreation and direct the therapeutic recreation practice. So we can see that it does have strengths, and it does have good outcomes when working with the client. A few of the weaknesses. One, it does not apply in all agencies, or specifically agencies that do not have health as a major goal. And a second weakness, and this comes from a critique on the specific model, the writer says that it implies an individualistic solution to health problems by focusing on changing the individual rather than on altering the social structure. So I guess what he's trying to say is that more tries to change the person instead of changing the outside factors. And then a third weakness he also mentions is that it needs further specification in its promising concept of health. So it just needs to be more well developed and have a little bit more description within it. The role of the recreational therapist. So our role within this model is helping people fulfill their needs through stabilization and actualization until the client can resume their responsibility. So just as the model showed, we're trying to get the client to be independent and make those decisions on health and understand what kind of benefits that has for them. And then we are, again, trying to give the client as much responsibility so they can become independent and function without us as the therapist. And then who does this model help? So the wonderful thing about this model is that it does target anyone and everyone. So essentially, if you wish to increase your level of health, then you can meet with a recreational therapist and they will help you increase on any aspect of your health. And so this isn't limited to only people with physical limitations or mental limitations. It really is anything that you want to increase your health on. This model will help. And then these are the resources. And if you guys have any questions, just let us know and we can help you out. Thank you for listening.